The Medicare Open Enrollment Period, from October 15th to December 7th, is crucial this year due to significant changes. The Inflation Reduction Act, passed in 2022, introduces major updates to Medicare Part D, effective in 2025. These include a $2,000 cap on annual out-of-pocket costs for prescription drugs, adjusted for inflation, and monthly payment plans for prescription drugs. These changes make it essential for beneficiaries to review and potentially switch their plans during this period to ensure optimal coverage and cost savings. This open enrollment period affects all 67 million people on Medicare, including those turning 65 and planning to enroll. Even if you have employer-provided health insurance, it's vital to review your situation. Not everyone can remain on their employer's plan, so checking if changes are needed for 2025 is crucial. This ensures you maintain adequate coverage and avoid unexpected costs. Your approach to the open enrollment period depends on your current Medicare coverage. Different scenarios require different preparations. Whether you're covered by an employer health plan, have a standalone Medicare Part D plan, or are enrolled in a Medicare Advantage plan, understanding your specific situation is key. Each scenario has unique considerations, and being informed will help you make the best decisions. Reviewing your current plan and comparing it with available options ensures you have the best coverage for your needs. If you're over 65 and have employer health insurance, your plan may not cover prescription drugs adequately in 2025. Your employer must send a letter detailing if your drug coverage is creditable. If it's not, consider switching to another employer plan, joining your spouse's plan, or enrolling in Medicare Part A and adding a standalone Part D plan. Avoid late penalties by enrolling within 63 days of losing creditable coverage. If you have a standalone Part D plan, expect your annual notice of change and evidence of coverage by September's end. These documents outline changes for 2025. Review them carefully to understand any adjustments to your drug coverage. Starting October 15th, use the Medicare Plan Finder tool at medicare.gov to compare plans. Look for changes in deductibles, premiums, and prescription pricing. Even if your current plan worked in 2024, it's worth checking for better options in 2025. If you're in a Medicare Advantage plan, you'll receive your annual notice of change and evidence of coverage in September. These documents explain changes to your prescription drug coverage and plan network. Review if your medications are still covered, if there are new deductibles or co-payments, and if your doctors and hospitals remain in network. Check for changes to extra benefits like vision, dental, or fitness memberships. Staying informed ensures you maintain the best coverage. If enrolling in Medicare in the fourth quarter, coordinate your Part D or Medicare Advantage plan carefully. If starting in October, sign up for a 2024 Part D plan and reevaluate for 2025 during the open enrollment period. If starting in November, you might choose a 2025 plan without switching for 2024. If starting in December, consider delaying your Part D plan until January if it doesn't impact prescriptions. Consult your insurance company to make the best decision. To maximize the open enrollment period, follow this checklist. Read every notice from your insurance company, including the annual notice of change and evidence of coverage, as soon as they arrive, based on prescriptions, pharmacy preferences, and medical needs. Volunteer for free, tailored guidance. This year's Medicare Open Enrollment Period is more critical than ever. With significant changes in 2025, especially regarding prescription drug costs, reviewing your plan is essential. Take action between October 15th and December 7th to avoid unnecessary expenses. By staying informed and prepared, you can navigate this open enrollment period confidently and make the best decisions for your healthcare in 2025. Ensure you're getting the best possible coverage and cost savings by being proactive and informed.